It's Thursday, 7th of May. And look who's here. It is Dr. Eugene Cherney.
Hi, everybody.
How are you? And we're talking about something today which is really important.
This is really important. This is really a public service kind of interview because it's Skin Cancer Awareness Month, and we're going to talk about skin cancer and how you should check your skin once a month, and what kind of things you should worry about, what things you should not. When should you go to the doctor to have it checked out? How's that sound?
Now this is interesting coming from a plastic surgeon, because my mom, who has skin cancer, she goes just to a regular or doctor that specializes in this, and they're usually the ones that take care of it. Do people go to a plastic surgeon for issues like this?
Actually, quite a lot. You know, there's many doctors that are really talented at handling this. We have excellent dermatologists in Des Moines, and many family doctors do the excisions of their family practice patients. You know, the skin cancers themselves also. I see them sometimes in my patients. This is so common that everybody comes in and has one anyway, and so I usually take care of them when they're my patient in the first place. Sometimes I see like the big cases that come from the dermatologist. They will remove these cancers, and sometimes by the time they're done getting it all out, the hole is so big that you need a plastic surgeon to fill it in.
Oh, okay.
Gotcha.
So, in fact, I did a few of those yesterday. That's what I do every Wednesday, actually.
Really?
What are we looking for? We don't want to turn the audience into an army of hypochondriacs, but what signs are we looking for in terms of things we should worry about on our skin?
Well, we have basically three types of skin cancers. Two are not that bad. Only one is really bad. Now they usually look something like this. It's if you have like kind of a pearly edge, or has a little bit of a volcano look with kind of a crust in the center.
Okay.
This is a classical basal cell cancer, and that's like 80% of them. This is from sun exposure. Probably every old farmer in the entire state of Iowa has had one of these.
Now, is this after sunburn you get these, or when do these pop up?
Yes, you get these. Just get these with chronic sun exposure, and actually, the ones that you get, like in later years of life, are probably from sun exposure you had when you were a kid.
Really?
It takes that long for the DNA damage, to actually express itself in this way. But on the bright side, they're very slow growing, and they really don't cause any terrible mischief unless you neglect them.
Right.
Okay.
See, they'll just they don't spread to different parts of the body like other cancers. They just kind of keep on growing until you cut them out.
Now, is this something that has just recently become more active when it comes to skin cancer, or has this been around all these years, but we're just becoming more aware of it?
It's been around forever. People are getting more aware of it. I would say that because of trends of people wanting to tan and people using tanning booths, I'm actually seeing them on younger and younger people. I have a 14-year-old who had one. Ooh. That's like crazy, because usually we see them on old farmers,
right?
Or guys that worked outside.
If you look at old pictures of farmers here in Iowa, I mean, they used, even when it was hot and you're out in the fields, they had long sleeves, they wore the big hat. Even my grandma used to do that. It didn't matter how hot it was outside, they covered up. But that's not really the trend anymore. You throw on a bathing suit to go spray beans just because you want to get some sun.
A tan.
You want to get a tan while you're working, So I think we're starting to see it more and more because people did actually protect themselves back in the day.
There really is no such thing as a healthy tan, right? I mean, if you're exposing yourself to that much sun, it's probably bad.
I like to tell my patients, that to use the traditional teaching that it's okay if it's in moderation. But who does anything in moderation anymore? I mean, that's kind of the
what part of the body are we most concerned with? Is there any one part of the body that's more susceptible of getting skin cancer than another?
Actually, very much so. The face is actually the most common location of these basal cell cancers, the nose in particular, and you'll see them sometimes on the arms and legs and trunk, but usually the face is where you see most of those.
Hey Doc, what about you and me? Here.
We'll get something up there eventually if we don't wear hats. That is true. That is true.
Or at least make sure your sunscreen.
Yeah.
Okay,
That's
right.
So we've seen the slow-growing kind. What's the kind that causes the most trouble and is the most dangerous?
The worst one.
I was going to say, let's go back to our images here.
That's the real bad actor.
What is that?
I hate this guy. This is malignant melanoma. I really hate it because it sometimes starts in just a very benign-looking mole, but then it starts to look a little different. The color changes. And this is the one that can spread to different parts of the body and kill you. And this is the one that really needs to go. I biopsy them when they're larger than 6 millimeters and when they have this irregular color or irregular border.
Okay.
But I actually like to take it one step forward, because I've taken off plenty of things that look pretty normal, and they turn out to be something pretty bad.
Wow.
Because, well, that's 'cause I've been practicing for 30 years, so you see stuff like that eventually.
Sure.
I ask a patient how it feels, and if they tell me that it hurts or it feels funny or it itches or it's bled or something like that, that to me is actually the most important criteria. Because when the patient feels that something's not right, patients usually know, so then I biopsy it.
Right. They're like, I just don't feel right about this. It's changed. Its appearance has changed.
Right.
It's gotten bigger. Okay.
And it's one of those things that's important to keep your eye on, like you said. At
Right.
least once a month you check them out. Like I'm very moly. Like you can't tell it here, but like on my back and my arms,
Yeah, I am too.
I have things like that all over the place, and I'm
Yeah.
constantly watching them to see if they change at all. And it's not always easy
And
to
that's
see,
good.
especially like on your back and things like that.
And your back is hard. It's ideal if you have a loved one that can look at your back. I mean, and I've seen these like hidden down in the butt crack of all places where you can't observe them.
Really?
And they're cancerous
Wow.
down in there. So that's, yeah, you have to have a real careful look sometimes, especially if you're moly like you are. Actually, someone that has like a lot of moles, a dermatologist will do a photograph and a mole mapping so that they compare year to year.
Oh,
and
that's
you
a
go
good
for
idea.
that. And
That
that's
is a good idea.
That's a real good thing for certain patients.
Okay.
All right. Now, when you do remove these marks that are on the body of these cancerous cells, do you have to fill in that area with something, or does it grow
Yeah.
back?
Well, you can either leave a hole that takes like months to heal and will leave a nasty scar, or you can do a nice closure so it looks pretty, and especially on the face you want to do that. So we remove them, and when we make sure, you look at the lab report and make sure that the whole thing's gone, and if the whole thing's gone, then you can do the closure.
Okay, got it. Well, for more information on these or anything else at your practice, how do people get a hold of you?
We're at Heartland Plastic Surgery, and that's heartlandps.com, and we would love to talk to you.
And it really is an amazing facility, too, if you have a chance to go over and check it out. It's unlike anything you've ever seen before. So
Thanks.
it is great. Thank you so much, Doc.
Yeah,
Good to see
thank you.
appreciate
Thank you, buddy.